Hey everyone, and welcome back to the channel. Today, we're diving into a really important topic in fetal imaging, meconium peritonitis. Let's break down what it is and what to look for on ultrasound. So what exactly is meconium peritonitis? It's a sterile chemical inflammation of the fetal peritoneum. Imagine this. The baby's first stool, called meconium, is normally sterile and stays inside the gut. But if the bowel perforates in utero, this meconium leaks out into the abdominal cavity. The body sees this as a foreign substance and mounts a major inflammatory response. This isn't an infection, it's a chemical reaction. The most common culprits for this perforation are blockages like intestinal atresia, a twisted bowel known as a volvulus, or sometimes conditions like gastroschisis. Now for the good stuff. What are the top 5 ultrasound features you need to spot? First and most classic are intra-abdominal calcifications. These show up as bright, echogenic spots scattered throughout the fetal abdomen. Think of them as tiny white flecks of calcified meconium. Second is fetal ascites. You'll see free fluid in the baby's abdomen. This is a direct result of the peritoneal irritation from the leaked meconium and can range from mild to severe. Third, look for dilated bowel loops. The sections of the intestine just before the perforation can become stretched out and filled with fluid because of the blockage. Fourth is a meconium pseudocyst. This is a fascinating finding. The body tries to wall off the leaked meconium, forming a cystic, often complex-looking mass. Sometimes, these pseudocysts have a thick calcified rim, which is a huge clue. And fifth, polyhydramnios. That's excess amniotic fluid. It's not always there, but it's common because the bowel issues can impair the fetus's ability to swallow fluid properly. When you see these signs, you have to consider other possibilities. For example, intra-abdominal tumors can look like masses, but they won't have the classic scattered calcifications. Torch infections can cause calcifications too, but they usually come with other signs like growth restriction or microcephaly. The key is that the combination of findings, especially calcifications, a pseudocyst, and dilated bowel, screams meconium peritonitis. So let's recap the take-home points. Meconium peritonitis is a chemical reaction, not an infection. The key ultrasound findings are calcifications, ascites, pseudocysts, and dilated bowel. And always try to hunt for the underlying cause, whether it's an atresia, volvulus, or another issue. Getting the diagnosis right is crucial for guiding management and counseling parents. Thanks for watching, and I'll see you in the next video.